Welcome. Most respected sir.
Good morning.
Actually, title members for this dedicated session. Last but not least, come all the finally become students and the foundation students will become students. The first day to be open for this dedicated session. I really successful have a very good time.
I honestly thought that every now and then this is the academic program registration.
Sir, your voice is not coming.
Hello. Is that good?
Yes. So can I start?
Okay, very good morning. Whatever subject you choose, whether it's science, after that they can say one. Is ahead of the developing countries. Even India is maybe 20, 30 years behind the Western countries. So that means we will be able to witness a lot of advanced facilities, amenities for living and learning about the new techniques. So in that way, the program that is organized by this career placement group headed by Dr. Satish Kumar is a wonderful opportunity for the students. And I also appreciate the speaker, Dr. Akram Ahmad, for guiding our students to place them in abroad. I wish this program a great success. Thank you for the opportunity.
Thank you so much, sir.
Thank you, sir. I invite our beloved principal, Dr. H. Mohan, Research Director, Dr. A. Nagarajan, to facilitate the event coordinator, Mr. Abdul Razak Azuluddin, with a token of love.
coordinator and officer. Any field which you want to enter, you have to get feedback from the experts. So these also use the guidance, but they are not really experienced person. But the opportunities are available in the very fast area. Clinical counseling from the evaluation of clinical beginning. When I was teaching students in 94, the Union Basis Institution that currently to Australia to get exposure to start clinical counseling. That happened, they started in 84 and happened only in 96. Started from practice working in the hospital. Department of Pharmacy practice initiated by Basis College of Pharmacy with the help of the University of Sydney. They sent faculty, they got exposure. So today we are lucky to have the University of Sydney give the guidance for all the students. It's an easy thing if the opportunities. I discussed with you. Not from the financial things. The guidance will be easy. They start from appearing the examination to get the PR. It's a very important opportunity for all the students. They place the opportunities. So whatever you have in that so the road you are turning, they will guide you. So once again, I take this opportunity. Thank for placement whatever it or arranging this wonderful opportunity for students. Also, I thank Abdul Rasaq for the coordinator. Above all, I thank the government. He's from Karpagam University for your concern for ready also. Thank you.
Thank you, sir. I call upon Dr. Lenit Prashant, Assistant Professor, Department of Pharmacy Practice, onto the dais for the speaker introduction. Academic, and he has taught pharmaceutical and clinical pharmacy at published over 100 papers, researchers, concepts, speaking like the Lancet infection disease. This is a total of 100 publications, total of 400 that points 2,200 publications, and the index between the 19 index 56 Akram is the recipient of prestigious Best Promising Research Award from the CSA University. The prize money of RM 10,000. Akram also recipient of International and Associate Australian Postgraduate Award and Institute of Scholarship in 2017 from the Government of Australia and the University to support the students of exceptional research potential in their studies. This recipient of the fast-track permanent residency is not to Australian Global Talent Immigrant Program. This research program is rated among the for top 5% of scientists on research data, a global professional network of scientists and researchers. He is the founder and the CEO of Academically. Academically was founded with a single goal in mind. The goal was to create qualified healthcare professionals across the globe, like pharmacists, medical doctors, dentists, nurses, lab technicians, research scientists, and so on. In achieving the vision and reach by educating and training them to acquire the necessary skills and competence in the digital next as a certified medical professional worldwide.
With elation, I invite our research person, Dr. Akram Ahmad, to take over the session.
Thank you so much, sir. So, hello everyone. My name is Dr. Akram Ahmad. So, I'm an Indian pharmacist, and I'm living and working in Australia. Today, I'm going to discuss for you the opportunities in Australia and New Zealand. Okay. So, if you have any questions or any doubts, you can ask me at the end of this webinar. So, academically, we are a Sydney-based company or in Australia. We provide assistance for all healthcare professionals like medical doctors, pharmacists, nurses, lab technicians, physiotherapists. So anyone want to work in these countries, so we provide them here to the assistance, so they can migrate from their home country to Australia. This is a little bit about myself. So I did my basically diploma in pharmacy, then lateral entry bachelor of pharmacy, then pharmd PB from Annamalai University, Tamil Nadu, and then I worked in India for 4-5 months as a assistant professor. Then I moved to Malaysia, where I worked around 4 years as a pharmacy practice lecturer. In last 6 years, I'm living and working in Australia and teaching this clinical pharmacy practice subject. Okay, this is about myself. So we provide two assistance. One is the study abroad. So if any student want to study in Australia, they want to do any master degree, we can help them in their admission process. But this process is very, very expensive. You need to pay the fees around 30 to 50 lakh Indian rupees to get your master degree done. So I do not recommend to anyone to go for this process. Okay. So what is the best pathway for you to migrate to Australia and New Zealand? You can do your registration. You can register yourself as a pharmacist in Australia. Then directly you need to come to Australia to work here as a pharmacist, as a registered pharmacist. Okay. So today we are going to discuss this whole process. So as a pharmacist, if you want to work in Australia, so you can work as a retail pharmacist or you can work as a hospital pharmacist. Okay. So for this, there is no need any work experience. So they need your just bachelor degree, bachelor of pharmacy 4 years, or you did your M.Pharm, or you did your PharmD, or are eligible to work in Australia. So there is some steps you need to complete in order to migrate in this country. The first step called initial skill assessment by APC, Australian Pharmacy Council. The whole process is you are doing, or this connected by a Australian Pharmacy Council. Okay, so this first step, they will see your degree, your transcript, your registration as a pharmacist in Tamil Nadu State Pharmacy Council, and then they will give you, yes, you are eligible to sit in the exam. Okay, so this is very easy process. We will help you to complete step 1 process. You just need to provide document, and then step 2 is a KAPS exam preparation. This is the exams you need to write and pass this exam. So there is an exam center in Chennai and also in the Bangalore. So you just need to go there and sit in this exam. And so this is a very easy exam. 50% marks you need to score, and this is a multiple choice questions. Okay, and no negative marking. So we will provide you the 4-month coaching for this exam. So very easy to crack this exam. Okay. And then step 3 is the English test. You also need to pass called IELTS, OET, or PT. Any test, you just need to pass one test, whether it is IELTS, OET, PT. Then you have to migrate to Australia. Okay, same for industrial pharmacist and technician, but here you need 2 year work experience. So industrial pharmacists need 2 year work experience. Pharmacy technician need 1 year work experience. But here as a pharmacist, it does not require to have any work experience. Okay. And these are the 3 steps that I mentioned you need to complete in order to migrate to Australia and New Zealand. But there is some difference in these two countries. First of all, Australia does not require any work experience, but New Zealand require at least 1 year work experience in any retail pharmacy or in the hospital pharmacy. Number one difference. Number two, basically, you can take unlimited attempt for this exam. If you fail first time, you can give second time, third time, fourth time for Australia. But New Zealand give only 2 attempts. Okay, and New Zealand is a very small country, not much scope. Australia is a big country, the good scope. And secondly, your age must be below 45 years of age. If you are planning to migrate, your age must be below 45 years for Australia. But for New Zealand, there is no age requirement. Okay, so this is are the 4 major difference when you are talking about the migration for pharmacists. So skill assessment, the step 1, you have to complete with Australian Pharmacy Council. They need your degree, transcript, registration as a pharmacist with State Pharmacy Council, your passport, national ID like Aadhaar card or any like Aadhaar card. Maybe you have a driving license or birth certificate if we need, and passport size photograph. So if you do not have birth certificate, still you can basically give this like your 10th mark sheet as well. And whole process, it may take around, you need to pay 1310 Australian dollar, around 70,000 Indian rupees you need to pay to complete this step 1 process. Okay. Then you have to go for step 2 about this exam. So to book this exam, you need to pay the fees 2230 Australian dollar to get in the exam. First of all, there is no negative marking for this exam, so very easy to crack this exam. And passing marks required only 50%. So they will ask you the question from these 4 domains: pharmaceutics, pharmacotherapy, pharmacochemistry, pharmacology, and physiology. So there is 2 papers you need to give in the same paper, paper 1 and paper 2. So paper 1, they will ask you for pharmaceutical chemistry 30%, okay, questions, and 70% from physiology and pharmacology. And same for pharmaceutics and pharmacotherapy. So you just need to score 50% and no negative marking. So very easy to crack this exam. Even if you don't know, you just guess the answer. So after 2 to 3 weeks, you will receive the result, whether you pass or fail. So in this result, doesn't matter your score. Maybe you just score 50% or 90%, doesn't matter. They do not mention in your result. They only mention that pass or fail. Okay. So once you pass this exam, then you start looking a job from India itself or start applying your visa to come Australia. So this exam they conducted in the 8 exam centers currently in India, like Delhi, Noida, Gurgaon, Pune, Mumbai, Bangalore, Hyderabad, and Chennai. So these are the exam centers in India. They conduct this exam yearly 3 times. Every year 3 times, like March, July, and November. The exam they conducted. Academically, you have very high passing track record. Around 93% student pass in the first attempt. You can read this article at the Pharma Tutor and another article. So English, you need to go for IELTS academic, OET, or PT academic. So OET we need B, or IELTS needs 7 individual band, or PT required 65. So any one test you need to give, whether IELTS or OET or PT, one test you need to pass in order to migrate to Australia. Same for industrial pharmacist, but need 2-year work experience here. And technician need 1 year experience, but for pharmacists required 0 work experience. Okay. So once you completed this whole process, then you are eligible to apply this visa, PR visa. Permanently, you can migrate to Australia on PR visa like 190, 491. These are the 2 work visas you are eligible. And this is the 407 training visa also. So these 5 visas you are eligible to apply for pharmacist once you complete this whole process. So first job, you have to work as an intern pharmacist for 1 year. You have to do internship in India, in Australia for 1 year. But this is not a free internship. You will get the salary around $30 per hour, means that you can earn around 3 lakh per month while you are doing your internship. And after 1 year, you can become a pharmacist, fully registered pharmacist. Then your salary is going to be 4 to 5 lakh Indian rupees per month in Australia. Okay. You can work in community pharmacies, work in hospital pharmacy, or also you can become pharmacist, clinical pharmacist, and all those things. Okay. And total time will take around 6 months to 1 year. So these are some of the reviews from our students, and these are our email address and phone numbers. You can contact us if you have any question. Or this is Abdul number is here, so you can contact him if you have any doubt. So this webinar is connected by this Abdul, arranging this Abdul. So you can just ask him if you have any doubt in Tamil. You can ask. So that's all from my side. Now I am happy to take some of your questions if you have any doubt or any questions. Or please, faculty can ask some questions if you have. Sir, is there any
Do you have any doubts? You can clarify.
So guys, I have another meeting, so I'm just leaving. Or you can just ask. Abdul is here. Our manager Amin also is here. So the guys will give you all the answers. Okay. Thank you so much for your time.
Thank you, sir.
That's a please. Sequence start.
Yes, Abdul. Do you have any question?
Sir, principal,
Your voice is not clear, Abdul. It's breaking up. Can you just type your question? Yeah, Abdul, can you repeat again, please?
sir, is it audible?
Yes, yes, it is.
Connecting now. He will be asking few questions.
Sure, sure, please. Yeah.
Yeah, thank you, Sir Aman.
Thank you, sir.
Yeah, regarding one thing, if students, I think all B Pharm, M Pharm, and PharmD students are eligible for registering clinical pharmacist in Australia. Huh?
Yes, sir. They can. Yeah.
for B pharmacy students, they need any experience after their undergraduate?
In Australia, sir, they don't require any experience. So Bachelor of Pharmacy students also are eligible, but for filing the skill assessment, they need to register themselves first with Home State Pharmacy Council, and thereafter file their skill assessment, which is a document evaluation, sir. And thereafter, they can sit in the examination.
Okay. He said that PT is also alternate for IELTS. That is a validity for once they clear PT exam.
Yeah, so they can clear either OET, PT, or IELTS.
Okay, so validity is 2 years or 1 year only? For
2 years. 2 years. Yeah.
2 years. Okay.
2 years. Yeah.
So once they register in the State Pharmacy Council, they can start applying.
Absolutely, sir. What I would recommend that those who are in the final year, sir, final year either in PharmD or they are doing internship, or they are in Bachelor of Pharmacy final year, or they are doing Master of Pharmacy final year, they can enroll with us for a training program. Because by doing the training, they can save at least 4 months. We do have a 4 months training program where 3 months are like live classes and 1 month is going to be a revision. And we will see their progress, how they are progressing and all by asking them to sit in the mock test. So once they are performing well, then we can ask them to sit in the examination. So for sitting in the examination, there is skill assessment to be done prior to that. And skill assessment takes at least 4 to 8 weeks of time, where they need all the documents along with their license also, sir.
Once their exam is clear, then they're eligible for applying, sir, right?
Absolutely, sir. So they need to proceed ahead with the initial skill assessment, where they need to produce their degree certificate and transcript, Aadhaar card, PAN card, and then their license. And we file their skill assessment with the APC, Australian Pharmacy Council. They will take 4 to 8 weeks of time. Once they approve that they are good to go ahead and sit in the examination, then they can register themselves for the upcoming examination. So examinations are going to be conducted 3 times in a year: March, July, and November, right? And
Okay.
want to take a training from Academically. Academically will take 4 months of time to train them. And once they feel enough confident to take the examination, they can sit in any of the upcoming examinations, sir. Once they clear the examination called KAPS, they'll have to write the English proficiency test called OET, PT, or IELTS. Out of these 3, anyone can write any of the English test, right, sir? Once clear the English test, then they can file their EOI and visa. EOI called expression of interest, sir. So they'll have to choose their states where they are intended to work, sir, right? And then their points are going to be evaluated, that how they have performed in the KAPS examination, what is the score in their English test, what is their age, how many dependents are there. So each and every component had some certain points, what degree they have done, right? So once they achieve at least 65 points, right, then they are eligible to apply for permanent residency visa, right? And they are going to get the permanent residency visa called subclass 190 or 491, sir.
Okay.
And then they can fly down there. Either they can fly down there in Australia and find out a job and start their job there, or they can find out a job from here also. We are going to assist them how they can find out a job, where they can find out a job, which state has multiple vacancies as a pharmacist, as a clinical pharmacist and all. So we will guide them for the placement assistance also, sir. So they can go there and start their career as an intern pharmacist first for 1 year. And once they work under the registered pharmacist for at least 8 to 9 months, then they are going to write their exam called OSCE, which is a practical test, which we call clinical trial, sir. So whatever they have learned in their internship, they are going to participate and perform there. And it is very easy test. They are going to ask from whatever they have learned in 1 year or 8 months or 9 months time, sir. So once they complete that test, the clinical trial, then they can register with the body called APRA, which is a pharmacy council, I can say, that which take care of the registration process for all the healthcare medical professionals there in Australia, in entire Australia. Once they register, then they can independently work as a retail pharmacist or hospital pharmacist there in Australia. And
What's the success rate for clinical examination? Success rate is 100% or?
it's like I can say that it is more than 90% because I haven't seen in my career that somebody has got failed, right, sir? So those who are like practicing there, they will be under the guidance of the registered pharmacist there. So they are going to teach them the regulations and all, right, sir? And based on those regulations, how they can practice there and all, they are going to ask certain questions, and they are going to give them a grade. So based on grade, they are going to file their license, and they
So
can
there is no,
get their license every year.
Okay.
Yeah.
there is no law exams and all like US. Each state they have law exam. The candidate has to appear after NAPLEX also.
Absolutely, absolutely. So in like it depends upon country to country also. Let's say I would take the example of OSCE examination, which I have talked about for Australia. OSCE
Okay.
examination for Canada, USA, and other countries are little tougher than the Australia, right, sir? So their Canadian OSCE examinations passing percentage is like 26 to 30% maximum, right? And for getting a visa also, it's a bit difficult in comparison to Australia. But Australia examination is a bit easier, and visa process is also is very easy.
I think Indian pharmacist ratio is more in Australia, right?
Yes, sir. Yeah. And they don't have competition, at least as of now, because they do have only 8 to 9 pharmacy college in entire Australia, sir. So there's a
Okay.
vacancies because they don't produce pharmacists there from those colleges much. So they require much skilled manpower, skilled pharmacists there. If you'll see, as of now, there are close to 3,000 vacancies are available as a pharmacist, sir, there in Australia. Yeah.
Thank you. Thank you. I think we'll
Any
to
questions
start.
from the audience?
Yes, start from students.
Sure, sir. Yeah, Abdul, if you are not able to like speak from there, you can type their questions. Take their questions and type. I can read out and answer them.
Can you just explain?
Yeah. I think Abdul Razak is there to continue further in offline to clarify our students' doubts at all.
Sure, sir.
So on behalf of all faculty and students, I express my sincere thanks to you. I hope we'll work in future also to get more placement for our KCP students. Already one student cleared this examination, B.Pharm students, with his own effort interest.
Great, sir.
So I hope many of the students, those who are audience today, will come forward and will grab this opportunity.
Sure,
Thank you very much for your valuable suggestions and your presence. Thank you.
Thank you so much, sir, for coordinating this and organizing this, sir. We'll keep
Yes.
organizing those kind of webinars
Yes.
here also, sir. Yeah. Thank you so much. Thank you so much
Yes.
everyone for participating in. Abdul can continue from there, from the campus itself.
Yes. Yes.
Yeah. Thank
Over
you.
to most.
Thank you. Thank
Bye.
you.